Hello, and thank you for joining me. My name is June, and I'm an assistant professor of product design at Drexel University. Today, I'll share findings from a cross-cultural review of age-friendly design strategies, drawn from 6 countries, and reflect on how design education, especially participatory work with immigrant older adults, can become a pathway toward healing and inclusion. Swedish actress Ingrid Bergman once said, "Growing old is like climbing a mountain. You get a little out of breath, but the view is much better." I begin with this quote because it reminds us that aging is not a problem to be solved, but a perspective to be honored. The view changes as we climb, and how we experience that view in later life is not just biological or individual, it is deeply shaped by cultural tradition. What stories we inherit about aging, by space, the environments and the systems we live within, and by social meaning, how our society sees, includes, or excludes older people. Whether aging feels empowering, isolating, sacred, or invisible depends a great deal on these layered forces. And that's why age-friendly design must begin with cultural humility. We are living in a global aging era, one that's accelerating rapidly. According to the World Health Organization, the global population is aging at an unprecedented pace. In the United States, adults over 65 made up 16.8% of the population in 2020. By 2050, the number is expected to reach 23%. And across many cultures, from East Asia to Europe and North America, most older adults share one deeply held preference: to age in place, in familiar surroundings. But despite this shared need, many existing policies and designs fail to reflect the cultural realities of aging. What's missing isn't just infrastructure, it's cultural grounding, respect, and relational thinking. To ground this work, I conducted a scoping review of over 80 sources across 6 countries: China, Japan, Singapore, Italy, Germany, and the United States. These included peer-reviewed articles, policy white papers, and news pieces, offering a mix of academic and applied perspectives. I used Arksey and O'Malley's scoping review methodology, which is especially well suited for mapping complex, interdisciplinary landscapes. Rather than evaluating impact, this approach helps us understand the range, depth, and the diversity of strategies that define age-friendly design and policy across cultures.
When we talk about aging design, we are not just talking about ramps or bus routes. We are talking about values. In East Asian contexts, aging is often shaped by filial piety and Confucian traditions, where family care is a moral responsibility and intergenerational bonds are central. In Western countries, aging is more often framed around autonomy and independence, the ability to not be a burden. These values inform design traditions, whether care is provided through the family or through systems changes how homes, communities, and policies are structured. So, if we want age-friendly design to truly work, it must begin by honoring the cultural values and the lived realities underneath it.
Despite cultural differences, many countries face strikingly similar challenges when it comes to supporting aging populations. Housing affordability remains a pressing issue, especially in urban areas where older adults are often priced out of the very communities they helped build. There's also a growing shortage of caregivers, both formal and informal, placing immense pressure on families and the systems. Transportation is another barrier. Even in cities with public transit, accessibility gaps can make daily life difficult for those with mobility or sensory needs. And beneath these structural concerns are deeper social ones: ageism, which shapes policy and perception, and social isolation, which quietly affects mental and emotional well-being. These challenges may look different across borders, but the emotional cost of being left behind is something older adults feel everywhere. Across these countries, we also see creative and promising practices emerging. In the UK, one of the most compassionate innovations is social prescribing, where doctors and nurses can prescribe not only medicine, but connection. Instead of simply treating symptoms, patients may be referred to a community garden, an art class, or a walking group, helping older adults rebuild relationship, purpose, and joy. It reframes health as something social, not just clinical. In Japan and Germany, we find in-home care and smart housing innovations. Japan's rural elder clinics bring medical support directly to aging villages. Germany's age-ready housing programs help retrofit homes with dignity in mind. And in the realm of transportation, countries like China and Japan are investing in smart, accessible transit, from e-buses to seamless light rail systems, helping elders stay mobile, safe, and socially engaged. These aren't perfect systems, but they show what's possible when design and policy are aligned with care. This is an image from Public Health England. From this image, you can see what is social prescribing. It's addressing people's needs in a holistic way. Doctors and other healthcare professionals can refer people to a range of local, non-clinical services, supported by a link worker or connector, like art studio activities, cooking, gardening, hiking, walking, reading, learning something new, and riding bicycles, a lot of activities which can enhance your mental and physical health instead of taking medication. While policy and infrastructure matter, aging is also shaped by the rituals, relationships, and recognition that surround us. In China, the Double Ninth Festival, 重阳节, is a day to climb mountains and honor one's elders, both literally and symbolically. It reflects the value of looking up to those who've come before. In Japan, Respect for the Aged Day is a national holiday that celebrates older adults with community events and student performances, reinforcing intergenerational bonds through joyful attention. And in the US, we see promising practices in intergenerational co-design, where students, designers, and older adults collaborate to imagine more inclusive futures. These experiences reduce ageism not through lectures but through relationship. These examples remind us that inclusion isn't just about services, it's about visibility, voice, and belonging. In response to these cross-national insights, I developed a framework called AFDSP, Age-Friendly Design Strategies and Policies. It offers a holistic cross-cultural model grounded in four pillars. First, preventive care, shifting our focus upstream to support health, connection, and well-being before crisis. Second, intergenerational education, because how we train future students directly shapes the aging environments they'll create. Third, participatory practices, inviting older adults not just as users, but as co-creators in shaping their futures. And finally, cultural responsiveness, the commitment to honoring local values, beliefs, and lived experiences. This framework is not a blueprint, but a lens, one that can be adapted across countries, disciplines, and communities. To bring the AFDSP framework to life, I organized its strategies across two key levels: policy and implementation. At the policy level, we need cross-sector collaboration, bringing together healthcare, housing, planning, and community services. Governance must be intentional, inclusive, and culturally sensitive. At the implementation level, we focus on what directly shapes older adults' lives. That includes age-friendly housing, accessible transportation, and inclusive communication technologies, what we call ICT access. We also need social inclusion infrastructure, community centers, programs, and gathering spaces, as well as systems that support aging in place. These aren't isolated fixes. They work together, like a living ecosystem, to help older adults not only survive, but truly belong. This framework doesn't live in theory alone. It comes to life in the classroom. In my Aging and Design course series at Drexel University, I introduced the idea of emotionally responsive teaching, a pedagogy shaped by Nodding's ethics of care and Richard's cultures of thinking. It's not just about teaching skills. It's about creating space for students to feel, to sit with discomfort, listen deeply, and to reflect on their assumptions about aging. Students in my class work alongside elders in immigrant communities. They co-create, not for them, but with them. And that shared vulnerability becomes transformative. Over time, I've seen how this approach can soften ageist biases, deepen empathy, and even shift students' own vision of their future selves. Because when we center care in education, we don't just teach design, we teach how to be human. Here in Philadelphia, I've had the privilege of working with Chinese-speaking immigrant elders through a series of co-design studios that pair them with my students. These intergenerational teams design together, listening, sketching, laughing, sometimes grieving. The process itself becomes the outcome. Because many older adults speak Mandarin or Cantonese, I invited volunteer translators to help bridge the language gap, not just for words, but for warmth, nuance, and trust. Before the workshops, students prepared in quiet, intentional ways. They researched Chinese traditions, visual symbols, and everyday ethic. They gathered culturally resonant images and stories. And they created creative toolkits, which is hands-on materials designed to engage elders in a way that felt familiar, respectful, and meaningful. In this way, students don't just learn how to design for aging, they experience what it means to build trust across differences. Through this work, I've seen transformation on both sides. Older adults feel heard and valued. Students gain empathy, humility, and creative insight. We are not just building prototypes, we are building healing, inclusion, and imagination in real time. If you are curious to see more, you can scan the QR code to visit our empathic co-design lab. If there's one thread that runs through this work, it's this: design cannot be separated from culture. First, cultural nuance matters. Age-friendly strategies that ignore local values often fail, not because they are badly designed, but because they are misaligned. Second, education is a pathway to inclusion. The classroom can be a site of deep social learning, especially when it invites students into authentic intergenerational dialogue. And finally, intergenerational collaboration can become a healing practice, not just for older adults, but for students, teachers, and communities, a space where empathy and imagination meet. These aren't just design principles, they are human ones. I will close with a question, not just for reflection, but for relationship. How can we co-create aging futures that are rooted in care, in respect, and in cultural fluency? Not just as designers or educators or policymakers, but as humans. I believe we each carry a piece of this work, and together, our differences can become strengths. Thank you for listening, for witnessing, and for walking this path with me. Here is my contact information. Feel free to email me, ask me questions, or follow me on Instagram. If you scan this QR code, they are Empathic Co-Design Lab's website. my LinkedIn profile, and my information on Drexel University's website. I'm looking forward to talking to you and answering any questions and discussing any collaboration possibilities. Thank you.